In the world of precision medicine, Olaparib, an innovative cancer treatment, is making waves. This groundbreaking medication holds the key to unlocking new possibilities in the fight against certain types of cancer, including ovarian and breast cancer. But how exactly does Olaparib work? And what are its potential uses and side effects? Olaparib, a PARP inhibitor, works by targeting cancer cells that have a specific DNA repair deficiency. By blocking the PARP enzyme, which plays a crucial role in DNA repair, Olaparib prevents cancer cells from repairing themselves, ultimately leading to their demise. This targeted approach distinguishes Olaparib from traditional chemotherapy, as it aims to selectively kill cancer cells while minimizing harm to healthy cells. What is Olaparib? Olaparib is an oral medication that falls under the class of poly-ADP ribose polymerase PARP inhibitors. PARP is an enzyme that plays a significant role in DNA repair. In normal cells, PARP helps repair damaged DNA and maintains the genome's stability. However, in cancer cells with a specific DNA repair deficiency, such as those with BRCA1 or BRCA2 mutations, PARP inhibition can be utilized as a therapeutic strategy. How does Olaparib work? Olaparib works by inhibiting the PARP enzyme, which prevents cancer cells from repairing damaged DNA. When cancer cells with a DNA repair deficiency are exposed to Olaparib, they are unable to repair their DNA effectively, leading to their ultimate demise. This targeted approach makes Olaparib a promising treatment option, as it selectively kills cancer cells while sparing healthy cells. Olaparib's mechanism of action also extends beyond simply killing cancer cells. Research suggests that it may induce synthetic lethality, a phenomenon where the combination of two genetic alterations leads to cell death. In the case of Olaparib, it specifically targets cancer cells with a DNA repair deficiency, such as those with BRCA mutations. By exploiting the inherent weaknesses of these cancer cells, Olaparib offers a novel therapeutic strategy that shows great promise in the field of precision medicine. Uses of Olaparib in cancer treatment. Olaparib was initially approved for the treatment of advanced ovarian cancer in patients with BRCA mutations who have received multiple lines of chemotherapy. However, its potential uses have expanded with ongoing research and clinical trials. Recent studies have shown that Olaparib may also be effective in treating breast cancer, particularly in patients with BRCA mutations. In addition to ovarian and breast cancer, Olaparib is being investigated for its efficacy in other types of cancer. Clinical trials are underway to explore the use of Olaparib in prostate and pancreatic cancer, as well as other solid tumors. Preliminary results are promising, and if successful, Olaparib could potentially revolutionize the treatment landscape for these cancers. Furthermore, Olaparib is also being studied as a maintenance therapy in patients with platinum-sensitive relapsed ovarian cancer. Maintenance therapy aims to prevent cancer recurrence or progression after initial treatment. By extending the time between relapses, Olaparib offers hope for improved outcomes and increased survival rates in patients with ovarian cancer. Clinical trials and research on Olaparib. The effectiveness and safety of Olaparib have been extensively studied in clinical trials. These trials have demonstrated the efficacy of Olaparib in various cancer types and have played a crucial role in expanding its approved indications. One landmark clinical trial, known as the SOLO-2 trial, evaluated the efficacy of Olaparib as a maintenance therapy in patients with platinum-sensitive relapsed ovarian cancer. The results showed a significant improvement in progression-free survival compared to a placebo, highlighting the potential of Olaparib in this setting. Another important trial, called Olympiad, examined the use of Olaparib in patients with HER2-negative metastatic breast cancer and a BRCA mutation. The study showed that Olaparib significantly prolonged progression-free survival compared to standard chemotherapy, providing a new treatment option for patients with this specific subtype of breast cancer. These trials, along with many others, provide a strong foundation for the use of Olaparib in cancer treatment. Ongoing research continues to explore the full potential of Olaparib and its effectiveness in different cancer types and settings. Potential side effects of Olaparib. Like any medication, Olaparib does have potential side effects. However, it is important to note that not all patients experience these side effects, and they can often be managed with the help of healthcare professionals. Common side effects of Olaparib include fatigue, nausea, anemia, and gastrointestinal issues. Fatigue is a common complaint among patients taking Olaparib, and it is important to listen to your body and prioritize rest and self-care. Nausea can be managed with anti-nausea medications or dietary modifications, such as eating smaller, more frequent meals. Anemia, characterized by a decrease in red blood cells, may require blood transfusions or other interventions. Gastrointestinal issues, such as diarrhea or constipation, can be addressed through dietary changes and medication adjustments. It is crucial for patients taking Olaparib to communicate any side effects they experience to their healthcare team. They can provide guidance and support to manage these side effects and ensure the best possible treatment outcomes. Safety precautions and considerations for taking Olaparib. Before starting Olaparib, it is essential to discuss the treatment plan with a healthcare professional. They will evaluate the patient's medical history, conduct necessary tests, and determine if Olaparib is the appropriate treatment option. Olaparib may interact with other medications, so it is crucial to inform the healthcare team about any other drugs or supplements being taken. They can assess potential interactions and make necessary adjustments to the treatment plan. Additionally, it is important to understand that Olaparib is not suitable for everyone. Genetic testing, such as BRCA testing, may be required to determine if a patient is eligible for Olaparib treatment. This testing helps identify individuals with specific DNA repair deficiencies who are likely to benefit from Olaparib therapy. Dosage and administration of Olaparib. The dosage and administration of Olaparib vary depending on the specific indication and patient factors. It is crucial to follow the prescribed regimen and consult with the healthcare team for guidance. Olaparib is typically taken orally, in the form of capsules or tablets. The healthcare team will provide detailed instructions on how to take Olaparib, including the recommended dosage, timing, and any necessary precautions. Regular follow-up appointments and monitoring are important to assess the treatment's effectiveness and manage any potential side effects. The healthcare team will determine the appropriate schedule for follow-up visits based on the individual patient's needs. Alternative treatments and therapies for cancer. While Olaparib has shown great promise in the field of cancer treatment, it is important to note that it is not the only option available. Depending on the specific cancer type and individual circumstances, alternative treatments and therapies may be considered. Chemotherapy remains a standard treatment for many types of cancer and may be used in combination with Olaparib or as a standalone therapy. Immunotherapy, targeted therapy, radiation therapy, and surgery are other treatment modalities that may be utilized based on the specific cancer characteristics and patient factors. It is crucial to have open and honest discussions with the healthcare team to explore all available treatment options and make informed decisions regarding cancer care. Patient experiences and success stories with Olaparib. The impact of Olaparib on patients' lives cannot be overstated. Many individuals have shared their experiences and success stories with Olaparib, highlighting its effectiveness and positive outcomes. Patient testimonials often speak to the improvement in quality of life, prolonged survival, and the hope that Olaparib has brought into their lives. These stories serve as a source of inspiration and encouragement for others facing similar challenges. However, it is important to remember that every patient's journey is unique, and individual responses to treatment may vary. It is essential to approach Olaparib with realistic expectations and have open conversations with the healthcare team about potential outcomes. Conclusion: the future of Olaparib in cancer treatment. Olaparib represents a significant advancement in the field of precision medicine and has the potential to revolutionize cancer treatment. Its targeted approach, ability to exploit specific DNA repair deficiencies, and expanding range of indications make it a promising therapy for various cancer types. While Olaparib is not without potential side effects, they can often be managed with the help of healthcare professionals. Regular communication with the healthcare team, adherence to the prescribed treatment plan, and self-care measures can contribute to a successful treatment experience. As ongoing research and clinical trials continue to explore the full potential of Olaparib, the future of cancer treatment looks brighter. By unlocking the power of Olaparib, we can unlock new possibilities in the fight against cancer and improve outcomes for patients worldwide. Thanks for watching.